A thrombectomy is an innovative surgical procedure used to remove blood clots from arteries and veins. Endarterectomy is a surgical procedure to remove the atheromatous plaque material, or blockage, in the lining of an artery constricted by the buildup of deposits. Thromboendarterectomy is a surgical removal of a thrombus from an artery along with atheromatous plaque material, or blockage. The interventional radiologist will insert a 3 mm plastic tube, called a sheath, into the base of your skull or your groin. They will guide the sheath to the blood clot. There are a number of different techniques for this procedure. The blood clot can be removed using a vacuum to suck the thrombus out, or mechanical equipment to break up the clot, or with clot using saline jets or ultrasound waves. An embolectomy is surgery to remove an embolus from an artery or vein. What is the difference between a thrombus and an embolus? A blood clot that forms in an undamaged vessel is called thrombus, and if it breaks loose and travels through the bloodstream it is called embolus. Thrombectomy, direct or with catheter, vena cava, iliac vein, by abdominal incision. The physician exposes the vena cava by making an abdominal incision. The vein may be clamped above and below the clot and incised. The physician removes the blood clot. The clamps are removed. If a catheter is required, it is threaded past the clot and a small balloon at its tip is inflated. The catheter is withdrawn, capturing and retrieving the clot. The blood vessel is repaired with sutures and the skin incision is repaired with a layered closure. Embolectomy or thrombectomy, with or without catheter, femoropopliteal, aortoiliac artery, by leg incision. Popliteal tibioperoneal, by leg incision. To remove a blood clot in the carotid, subclavian, or innominate artery, the physician makes an incision in the skin of the neck, usually in front of the sternocleidomastoid muscle over the site of the clot, or immediately above it. The artery may be clamped above and below the clot and incised. The physician removes the blood clot and sutures the artery. The clamps are removed. Thrombectomy of arterial or venous graft, other than hemodialysis graft or fistula. To excise the thrombus from the graft, the blood vessel is clamped above and below the thrombus, an incision is made into the vessel or graft and the thrombus is removed. The graft or vessel is sutured at the site of the thrombectomy and the clamps are removed. To remove the thrombus with a catheter, the physician makes an incision in the vessel above or below the graft and threads the catheter past the thrombus. A balloon or tool at the tip of the catheter is inflated or extended. The physician withdraws the catheter, repeating as necessary, to capture and retrieve all of the thrombus. The blood vessel is repaired with sutures. After either procedure, the skin incision is repaired with a layered closure. Thrombectomy of arterial or venous graft, other than hemodialysis graft or fistula, with revision of arterial or venous graft. The thrombotic graft is removed, the graft site is repaired with sutures, and, avoiding the repair site, a new graft is sutured into place on the vessel. The skin incision is repaired with a layered closure. Thrombectomy, open, arteriovenous fistula without revision, autogenous or non-autogenous dialysis graft. The fistula is isolated and dissected free. Vessel clamps are affixed above and below the fistula. The blood clot is removed, the clamps are taken off, and the incision is repaired by layered sutures. The procedure may involve a vein acquired from the patient or the construction of a synthetic graft. Pulmonary artery embolectomy, with cardiopulmonary bypass. Without cardiopulmonary bypass, the physician opens the right atrium widely. If cardiopulmonary bypass is not used, the right atrium is opened through a hole in the middle of a purse string. The clot is milked out of the pulmonary artery into the right atrium and out the hole. Pulmonary endarterectomy with or without embolectomy, with cardiopulmonary bypass. Repair of pulmonary artery stenosis by reconstruction with patch or graft. The blocked arteries are opened along their lengths. The inner layer of each artery is removed. The outer layer of each artery is closed with suture directly or with a patch of pericardium, saphenous vein, or dacron. Contrast is injected through the sheath and a separately reportable venography is performed to visualize the area of the vein being treated. Fluoroscopic guidance may be used. A guide wire is inserted through the sheath and advanced past the clot. A catheter is passed over the wire to the blocked area. A device at the tip of the catheter, a mechanical tool or a high-velocity liquid jet, is used to break the clot. A thrombolytic agent may be injected.